Today I'm going to talk about the treatment for obesity, both general obesity and pot belly. It is important that if you have any of this, that you pay attention closely because it is important that you solve this problem. Why are we worried about obesity, general obesity and pot belly? They cause certain diseases and problems for you. First of all, you are at risk of developing stroke. You see weakness of one side of your body, and you are unable to walk or do your routine activities. It also puts you at risk of having pneumonia and also put you at risk of developing obstructive sleep apnea, which is a condition in which someone snores a lot whenever he sleeps, and when he sleeps he has periods in which you feel like he's not breathing. If you have a spouse that has obesity or pot belly, you will notice that the breathing at night or anytime he or she is sleeping, there is that difficulty in breathing. Is obstructive sleep apnea. Apart from that, there's risk of developing heart attack. Also, you may develop fatty liver where you have fat accumulation in your liver. You are also at risk of developing different kinds of cancer. Because the weight is too much for your bones, you will have a lot of issues with back pain and knee pain. A lot of people usually use brufen and other medications to relieve that pain, but that is not the solution. You have to go to the root of the problem and take care of it. You're also at risk of diabetes, hypertension, problems with cholesterol, also high uric acid. So it is important that you treat it. So how do you treat it? First of all, your diet. You must stop all simple sugars. The issue of stopping sugar is not only for diabetes patients, but anybody that has obesity, both general and pot belly. You must stop it. You must also eat small with a lot of vegetable. Portion control is very important. And you must not eat multiple times. Eat morning, afternoon, night. And in between those meals, take healthy snack like garden egg, like cucumber. It is also important that you engage in exercise 30 minutes a day, 5 times a week. But when you start, you can start gradually, 5 minutes, 10 minutes. Before you know it, you'll be able to do 15 minutes to 30 minutes. So, but we want at least 30 minutes. After doing that, then there are medications that we may give you to aid you in the process of weight loss or losing that pot belly. It is also important to know that sometimes these ones are not enough. You need to go for surgery. There are places in this country that you can go for surgery. Also places in India, in London, in Turkey, where they will reduce the size of your tummy to enable you eat small and lose those weight. But even after the surgery, it is important that you maintain the dietary advice I earlier stated and also engage in exercise.